mediastinum to the superior and inferior mediastinum. And in the inferior mediastinum, a part of inferior mediastinum that is location of the heart is called middle mediastinum. Anterior to middle mediastinum, there is an anterior mediastinum. It's very narrow part of the mediastinum, and thymus is located in the anterior mediastinum. And posterior to the location of the heart, there is posterior mediastinum. Superior mediastinum, superiorly has a border, that this border is inlet of the thorax. Superior border of the superior mediastinum is thoracic inlet. Thoracic inlet is composed of first ribs and superior border of the manubrium sterni, jugular notch, and posteriorly is T1, first thoracic vertebra. This is oblique. And inferior border is a conventional plane between sternal angle and intervertebral disc between T4 and T5. Yeah, and lateral walls of the superior mediastinum are parietal pleura on each side. Major structures that are located in the superior mediastinum include thymus, that a part of thymus is in the superior mediastinum and a part of them is, this organ is in the anterior mediastinum. Right and left brachiocephalic veins. Right and left brachiocephalic veins. Left superior intercostal vein. Superior vena cava. Arm of the aorta and its branch. Large branches, 3 large branches, brachiocephalic artery or trunk, left common carotid artery and left subclavian artery, trachea, esophagus, phrenic nerves, vagus nerves, and left mechanolaryngeal branch of the vagus nerve, and thoracic duct and other small nerves and vessels and ligaments. You see here, left brachiocephalic vein and right brachiocephalic vein. Each brachiocephalic vein on each side is formed by attachment of 2 veins, internal jugular vein and subclavian vein, posterior to the sternoclavicular joint. Okay, posterior to the sternoclavicular joint, internal jugular vein and subclavian vein attach together and make brachiocephalic vein. Left brachiocephalic vein has 2 times more length in comparison to the right side. Why? Because 2 brachiocephalic veins joined together, attached together, posterior to the first costal cartilage. Posterior to the first costal cartilage on the right side. Okay? First costal cartilage on the right side. You see here, left brachiocephalic vein crosses anteriorly large branches of the arc of aorta. Left subclavian, left common carotid, and brachiocephalic trunk. You see here. Posterior to the first intercostal cartilage on the right side, two brachiocephalic veins attached together and make superior vena cava. This is superior vena cava. Superior vena cava has 7 centimeter length. 7 centimeter length. And half of this length is in the superior mediastinum, and inferior half of this length is in the pericardium, the middle mediastinum. Okay? Before entering to the pericardial sac, arc of azygous vein drains into the superior vena cava. You see here arc of aorta. Arc of aorta. You know that ascending aorta emerges from left ventricle and then ascends anteriorly and to the right side. At the level of sternal angle, ascending aorta becomes arc of aorta. This is arc of aorta. Arc of aorta at first is anterior to the trachea. From this position goes posteriorly and to the left side. This is arc of aorta. At the level of intervertebral disc between T4 and T5, arc of aorta becomes descending aorta. Thoracic aorta becomes descending thoracic aorta. From convexity of arc of aorta, 3 main or large branches emerge. First one is brachiocephalic trunk. Brachiocephalic trunk has 5 centimeter length and ascends to the upward and right side. And posterior to the right sternoclavicular joint here, brachiocephalic trunk divides into 2 branches, right subclavian artery and right common carotid artery. Right subclavian and right common carotid arteries. You see here. Second branch is common carotid artery. Common carotid artery is on the left side of the trachea and ascends to the neck. And third branch is left subclavian artery. You know that subclavian arteries on the right side and left side, both of them, passes through superior surface of the first rib on each side. Yeah? And on the lateral border of first rib on each side, subclavian artery becomes auxiliary artery. Do you remember? On the lateral border of the first rib on each side, subclavian artery becomes auxiliary artery in the axillary fossa. In this cross section, you see some structures in the superior mediastinum. This is trachea, and this is esophagus. Esophagus is anterior to the vertebral bodies. Yeah. Posterior to the esophagus, there is thoracic duct, and anterior to the esophagus, there is trachea. These are branches of the arc of aorta. Brachiocephalic trunk, left common carotid, left subclavian artery. And these are brachiocephalic veins, right and left brachiocephalic veins, and this is thymus, and this is manobrium sternum. Is it clear? This is transverse or axial section from the superior mediastinum. What is this and this?
Lungs. Lungs.
Lungs. No. These are lungs. I told you, thymus is a bilobulated, asymmetric bilobulated organ in the superior and anterior mediastinum. You see here, this is thymus. Superior part of the thymus is in the superior mediastinum and inferior part is in the anterior mediastinum. Upper extent of the thymus can reach into the neck as high as the thyroid gland, a lower portion typically extends to the anterior mediastinum. Okay, I told you about right and left brachiocephalic veins. Another structure in the superior mediastinum is left superior intercostal vein. Left superior intercostal vein. This vein drains into the left brachiocephalic vein. Drains into the left brachiocephalic vein. This vein receives second, third, and sometimes fourth posterior intercostal veins on the left side. Usually the left bronchial veins and sometimes the left pericardiacophrenic vein. Left pericardiacophrenic vein. It passes over the left side of the aortic arch. This is aortic arch. It passes over the left side of the aortic arch. Lateral to the left vagus nerve. This is vagus nerve. This is left vagus nerve. Okay? And medial to the left phrenic nerve. This is phrenic nerve. Left phrenic nerve. This vein is lateral to the left vagus and medial to the left phrenic nerve. Before entering to the left brachiocephalic vein, I told you, drains into the left brachiocephalic vein. Inferiorly, it may connect with the accessory hemiazygous vein. This vein is accessory hemiazygous. This is hemiazygous vein, and this is accessory hemiazygous vein. And here is descending aorta. Yeah? Is it clear? Yeah? Okay. Is it clear? Come, explain. Come and explain. Yeah? Come here and explain.
غير المكان.
ما كنت
مثل
بشوف
نعم بس بعد
بالشارع بس
غير المكان. غير
ما نقعد
ما يمكن أقول لهم بلشوا
انا راح يمر او هي الفلسيه بلاد الطارق هيك صوت
غير المكان. صوت الطلاب.
عشت لك اوقف اوقف هاي هي اجت النظرة راح مستقيم
احمد قدم هنا قدام. نعم. قدم.
Stand up, stand up,
قوم قدم.
stand up. Come.
طب يصير يشيلها
اوفر الكرسي ابقى راسي هنا.
يا حبيبي
كيف احمد زاهد ولا مره قاعد عندي قدام ما ادري
صوتكم طلاب.
كمل
This is left superior intercostal vein. Left superior intercostal vein. Here. Okay? It may be attached to, connect to accessory hemiazygous vein. This is accessory hemiazygous vein. This is accessory hemiazygous vein. This is left vagus nerve and this one is left phrenic nerve. And here is arc of aorta. Is it clear? Left superior intercostal vein drains into the left brachiocephalic vein. Drains into the left brachiocephalic vein. I will ask you, right superior intercostal vein drains into which one? Left superior intercostal vein drains into which one? Okay? Left superior intercostal vein drains into the left brachiocephalic vein. Okay? There are difference between left and right side. I told you, I said superior vena cava has 7 centimeter length. Half of this vein is located in the superior mediastinum and inferior half in the pericardium, in the middle mediastinum. In the midway of the superior vena cava, before entering to the pericardial side, arc of azygous vein drains into the superior vena cava. And superior vena cava is formed by right and left brachiocephalic veins. Is it clear? In the radiography of the thorax, superior vena cava can be easily visualized forming part of right supralateral border of the mediastinum. Right supralateral border of the mediastinum. Okay? Superior vena cava makes right supralateral border of the mediastinum in the chest radiograph. Here is arc of aorta. Beginning of arc of aorta is at the level of sternal angle, and end point of the arc of aorta is at the level of sternal angle or intervertebral disc between T4 and T5. Yeah? And I told you there are three branches from convexity of the arc of aorta. In the thorax, there are three parts of the aorta. Ascending aorta in the middle mediastinum, arc of aorta in the superior mediastinum, and thoracic descending aorta in the posterior mediastinum. Ascending aorta in the middle mediastinum, arc of aorta in the superior mediastinum, and descending thoracic aorta in the posterior mediastinum. You see here anterior view of the arc of aorta, and this is posterior view of the arc of aorta. And these are branches of the arc of aorta. I told you about branches of arc of aorta. Brachiocephalic trunk, left common carotid, and left subclavian arteries. In some cases, in addition to superior thyroid and inferior thyroid arteries, there is thyroid ema artery. Not in all people. In some cases. This is a variation. Thyroid ema artery is a branch of brachiocephalic trunk that ascends anterior to the trachea and enters to the inferior border of the isthmus of the thyroid. Superior thyroid arteries and inferior thyroid arteries are common in all people. But in some people, maybe, in some cases, maybe a branch of brachiocephalic trunk ascends anterior to the trachea and enters to the inferior border of the thyroid gland. This artery is called thyroid ema artery. Thyroid ema artery.
Doctor, in this case, the thyroid have 4 branches. Thyroid have 4 branches in this
Yeah,
case?
yeah. Left common carotid artery arises from arc of aorta immediately on the left side and slightly posterior to the brachiocephalic trunk, and ascends through the superior mediastinum. Ascends to the superior mediastinum along the left side of the trachea. Left common carotid artery supplies the left side of the head and neck. And left subclavian artery arises from the arc of aorta on the left side and slightly posterior to the left common carotid artery, ascends in the superior mediastinum and along the left side of the trachea. Left subclavian artery is the major blood supply to the left upper limb, upper extremity. Another structure in the superior mediastinum is ligamentum arteriosum. Ligamentum arteriosum is a ligamentous structure between arc of aorta, concavity of arc of aorta, and bifurcation of pulmonary artery. In the embryonic period and fetal period before birth, there is a duct between aorta and bifurcation of the pulmonary artery. This duct is called ductus arteriosus. Ductus arteriosus. After birth, ductus arteriosus becomes ligamentum arteriosum. Okay? Ductus arteriosus closed and becomes ligamentum arteriosum. In the superior mediastinum, a part of trachea and a part of esophagus are located. Trachea and esophagus, both of them, begin at the level of inferior border of the cricoid cartilage of the larynx. Inferior border of the cricoid cartilage of the larynx at the level of C6. This is larynx, and this cartilage is cricoid cartilage. Cricoid cartilage. At the level of inferior border of cricoid cartilage, or at the level of C6, trachea and esophagus, both of them, begin and descend. Some part of these structures are located in the neck, and trachea descends in the superior mediastinum, and at the level of external angle divides into right and left main bronchi. Right and left main bronchi. But esophagus, after descending in the superior mediastinum, enters to the posterior mediastinum, and posterior to the heart descends. Esophagus is a muscular tube, and it has about 25 centimeter length. 25 centimeter length. Upper 6 centimeter of the esophagus is located in the neck. And then esophagus enters into the superior mediastinum and then to the posterior mediastinum. At the level of T10, esophagus passes through diaphragm and enters to the abdomen. And at the level of T11, esophagus attached to the stomach, the cardia of the stomach. At the level of T11. Okay? About 6 centimeters of this tube is located in the neck, and 1.5 centimeters of this tube is located in the abdomen. Remaining parts are located in the superior and posterior mediastinum. Is it clear? Stomach.
Yes, it makes 6 centimeters. What about
Esophagus has 25 centimeter length. Upper 6 centimeter is in the neck. 1.5 centimeter in the abdomen that attached to the stomach. I told you it passes through diaphragm at the level of T10 and attached to the diaphragm, to the stomach at the T level. Abdominal esophagus has 1.5 centimeter length. Is it clear? This is cross section from superior mediastinum. Here is arc of aorta, and this is trachea. This is esophagus. You see, and this is superior vena cava. Vagus nerves are longest cranial nerves. How many cranial nerves are there in the human body? How many?
I know three.
12 pairs. 12 pairs of cranial nerves. Yeah? 12 pairs of cranial nerves and 31 pairs of spinal nerves. The longest cranial nerve is the vagus nerve. Cranial nerve number 10. And the largest one is trigeminal nerve. Cranial nerve number 5. And the smallest one is trochlear nerve. Cranial nerve number 4. Vagus nerve has sensory and motor and parasympathetic fibers. Vagus nerve has sensory, motor, and parasympathetic fibers. Okay? And this nerve is the longest, the most longest cranial nerve because begins in the brain, in the medulla oblongata, and descends in the neck, and then descends in the thorax, and then enters to the abdomen and descends in the abdomen. This is the longest cranial nerve. As they pass through the thorax, they provide parasympathetic innervation to the thoracic viscera and carry visceral afferent from the thoracic viscera. Visceral afferents in the vagus nerve relay information to the central nervous system about normal physiological process and reflex activities. They do not transmit pain sensation. Vagus nerves do not transmit, conduct pain sensation. Is it clear? Okay? Vagus nerve doesn't transmit or conduct pain sensation. Is it clear? Read. Read this. Louder.
They do not transmit pain sensation.
What's the meaning of this?
I ask you about
Tell Arabic. Tell Arabic.
what you say is sensory.
Yeah.
You say it's sensory.
I will tell.
You say it's sensory. It's not transmit the pain.
I have a question about your question. Does the pain equal to the sensory or sensation? No. There are many types of sensation, such as touch, pressure, yeah, pain, temperature. All of them are sensation, and there are specific sensation, such as visualize, vision, smelling, tasting, hearing. Yeah?
Do all of them have different nerves? All of them have different sensation. All of them have different nerves.
What do you mean?
They like smell, pain, or anything.
Some of them have specific nerves, and some of them has general.
Come.
For example, come here. Vagus nerve has sensory and motor and parasympathetic fibers. Can you sense these?
Victor, we can't
Each.
see.
This is auricular branch of the vagus nerve for external acoustic loudness. Can you sense this? This part, this is sensation of the facial nerve. Okay? In your ear, there are two nerves here. Okay? Can you sense this? This is greater auricular nerve from spinal nerve. Is it clear?
Yes.
Sensation doesn't have equal meaning to the just pain or just temperature.
All of the sensation.
All of sensation. Vagus nerve doesn't have a pain sensation, but it has touching in the external acoustic valves. Is it clear?
Yes.
Okay? Is it clear? Why do you love it? شما به آدم شجاع چی میگید؟ دلاور شجاع چی میگید؟ شجاع He's شجاع.
Why, Victor?
Does he question you?
Come here
Yes.
without asking why. Very yeah. Came here. Do you have شجاعات?
Yes, Doctor, but this شلون تقول له؟
This.
I will ask you.
Yes. Ask you? I ask you. After I come on the stage.
I will ask you and you are coming here.
ما هو سأله قال له ليش شجاع؟ قال أنا سألني وجبته.
يقول لك شنو هتضرب؟
شو بيجي؟ عربي ده اللي بعد تمشي. بالعربي. ليه ما فوش؟
قال على مستوى شجاع لأن سأله للدكتور وإجى.
لان الدكتور بس قال له تعال راسا قام من
هيك هي ما يخالف.
مشجع يلا.
اوكي اوكي.
مشجع ولا مشجع؟
You are شجاع too. Not two times. Two. T double O.
اوكي.
So give him a mark for his bravery. Give him a mark for his bravery.
A mark.
Yes.
For what?
Because he gave to you without asking.
مش راح يسوي Very good.
Okay. Right vagus nerve enters to the superior mediastinum and lies between the right brachiocephalic vein and brachiocephalic trach. Brachiocephalic vein and brachiocephalic trach. It descends in their position, posterior direction towards the trachea. This is trachea. Posterior direction toward the trachea, crosses the lateral surface of the trachea, and passes posteriorly to the root of the right line to reach the esophagus. Here is esophagus. And you see here, after crossing to the arc of the osseous vein, it descends posterior to the right line root. Right line root here. As the right vagus nerve passes through the posterior superior mediastinum, it gives branches to the esophagus, cardiac plexus, and pulmonary plexus. This is left vagus nerve. Left vagus nerve enters in the superior mediastinum to the left brachiocephalic vein and between the left common carotid vein and left subclavian, common carotid artery and left subclavian artery. As it passes into the superior mediastinum, it lies just deep to the mediastinal part of the parietal flora and crosses the left side of the arc of aorta. Left side of the arc of aorta. It continues to the descent in a posterior direction and passes posterior to the root of left line and reach to the esophagus in the posterior mediastinum. As the left vagus nerve passes through the superior mediastinum, it gives branches to the esophagus, cardiac plexus, and pulmonary plexus. And when descends anterior to the aortic arch, it has a branch, left vagus nerve has a branch that turns around the aortic arch and ascends between trachea and esophagus. This nerve is called left recurrent laryngeal nerve. Left recurrent laryngeal nerve. On the right side, right recurrent laryngeal nerve is a branch of right vagus nerve. When vagus nerve passes between right subclavian vein and right subclavian artery and turn around first part of the right subclavian artery. Okay? Recurrent laryngeal.
Why laryngeal?
Recurrent laryngeal nerve turn around the right subclavian artery on the right side and turn around the aortic arch on the left side. This nerve on each side ascend between trachea and esophagus, in the sulcus between trachea and esophagus, and these nerves enter to the larynx for innervation of laryngeal muscles and sensory of the larynx. Recurrent laryngeal. Recurrent is are inferior to the larynx, and then come back to the larynx. Recurrent laryngeal nerve. Is it clear? There are two phrenic nerves. Phrenic nerves are sensory and motor. They have sensory fibers and motor fibers. If I ask you, which nerve is a motor nerve for the innervation of the diaphragm,
Phrenic.
you answer me just phrenic. Yeah?
Review question.
But motor nerve of the diaphragm is phrenic nerve. Yeah?
Yes.
Motor nerve to the diaphragm is phrenic nerve. But phrenic nerve has sensory fibers for sensory innervation of the diaphragm and pericardium. Okay? You see here, right phrenic nerve descends between subclavian vein and artery, and then enters to the thorax, to the superior mediastinum, on the posterolateral position to the superior vena cava. Posterolateral position to the superior vena cava. And then enters to the middle mediastinum between parietal pleura and fibrous pericardium, and descends between pleura and pericardium and enters to the diaphragm in the hiatus of the inferior vena cava. Inferior vena cava. But left phrenic nerve has similar way to the right phrenic nerve from C3, C4, C5 segments, and descends between left common carotid artery and left subclavian artery, and then passes through anterior surface of the arc of aorta, and in the middle mediastinum is located between fibrous pericardium and parietal pleura, and at the level of apex of the heart enters to the diaphragm. You see here, this nerve is right phrenic nerve. This is superior vena cava, and this is right phrenic nerve. This is right phrenic nerve. Pericardiacophrenic vessels accompany it through most of its course in the thorax. Right phrenic nerve leaves the thorax by passing through the diaphragm with the inferior vena cava. This is left phrenic nerve. This is left phrenic nerve. Left phrenic nerve follows the left side of the pericardial sac within the fibrous pericardium, anterior to root of the left line. You should remember that in the root of the line, phrenic nerve is anterior to root of the line on both sides. Okay? Both sides. Phrenic nerve is anterior to the root of the line, and vagus nerve is posterior to the root of the line. Is it clear?
Yes.
Yeah? Vagus nerve is posterior to the root of the line, And phrenic nerve is anterior to the root of the line. On both sides this is left side. Yeah, this is vagus nerve. Here is root of the line. Yeah, left side. This is vagus nerve, and this is phrenic nerve. Is it clear?
Yeah.
A part of thoracic duct is located in the superior mediastinum. Thoracic duct is the major lymphatic vessel in the body. It has 48 centimeter length. 48 centimeter length, and begins in the abdomen as a dilated structure that is called cisterna chyli. Cisterna chyli. This is the largest and most important lymphatic duct. Thoracic duct ascends in the posterior mediastinum and enters to the superior mediastinum inferior slightly to the left of the midline, having moved to this position just before leaving the posterior mediastinum opposite the vertebra level T4 and T5, and continues through the superior mediastinum posterior to the arc of aorta and is initial portion of the left subclavian artery between the esophagus and left mediastinal part of the parietal floor. This is thoracic duct. This structure is thoracic duct. Okay. After 10 minutes